Hi, this is video number 16. Today is March 15th, 2016. Exactly 4 weeks ago today, I had my surgery done. I debated in my head about even making this video because I felt not much has changed since my last video, my 3-week video. But then I really started thinking about it, and when it comes to posting things online, I always tell myself I want to be truthful, be positive, or I don't want to post anything at all. So if I'm having a bad day, I'm not just going to come on here and talk to the camera and complain about my one bad day. I don't even like being on camera. If you would have watched all my other videos, you know that by now. I don't like doing this, but I want to also document my journey, and I want to help others. So I had to make this video because I didn't want to take any action at all. So now it's, do I tell the truth or do I be positive? And I want to do both of those things, but when it comes down to it, they're clashing right now, because so I'm just going to go with the truth. The truth is, since a week ago, I'm getting better physically, but I'm getting worse mentally. So I'm sure I'll be fine, but I'll just kind of run through it real quick. So we'll start with the physical stuff. My scars are doing better, I think. I've been using the scar cream. I think my chest is a little lopsided. I think it sinks down lower on this side. Either that's just because I didn't work out those muscles the right way because of the way the pectus was, or that's the way it popped out. I don't think it sank back in at all. I went and looked. It always was like that. You can't really tell, but I guess I can tell because I look at it every day. But anyway, physically I'm doing better. It still hurts to twist. It still hurts to bend over. About a week ago when I bent over, I could barely touch my knees. Before the surgery, I could almost put my hands flat on the ground. I could definitely touch my toes. Today, I'm about 6 inches away from my toes when I go to bend over, so I'm making progress. Twisting, like I said, is pretty difficult. Getting in and out of bed, it's pretty difficult. Getting up from a chair or seated position is getting easier. So I'm really looking forward to sleeping on my side and stomach soon. I hope that comes sooner than later. So I'm off my pain medication, and I'm back to work as of yesterday. So I have a 10-pound, 6 to 8 week lift restriction. So I'm just basically programming, setting up files, and doing whatever I do at my work. I'm not lifting anything, put it that way. So that's all good there. So I just had a string of bad days mentally. I don't know what's going on. I have guesses. I know I'm going to get through it, and I'm not trying to be on here whining or complaining about it. I just want to document this whole journey, and this is part of that journey. So lately, just out of the blue, I just have these overwhelming feelings of sadness, and I just start crying out of just nowhere. I just will start bawling. I could do it right now. Before I go any further, I want to apologize for using anyone's names on these videos in case anyone doesn't want their name mentioned. I didn't ever ask for permission to use anyone's name. So if I use anyone's names in the past, in my past videos, I want to apologize. Not that anyone has complained or anything, like I said, but I went back and watched all my videos since my surgery, and I don't remember much. It's kind of scary being on all that medication. I'm glad I had the ability to document what I documented. but I just know I mentioned a few people's names, and they may or may not have been fine with me mentioning them or not. I don't know. But not that many people watch this YouTube thing anyway. But I just wanted to apologize, and I won't use people's names, or I'll try not to going forward, unless they specifically say to. But anyway, I'm kind of avoiding the depression thing. And it really just sunk in to me, like, I mean, no pun intended. I knew what this whole journey was going to entail, basically. I knew it was going to take a toll on me physically, mentally, and financially. And I've had so much help. And again, I'm not complaining. But it just really hit me that in 3 years, I got to go do all this again. And I got to get back out to Phoenix again, live there again, and get around there again. And I've had opportunities from family members to stay with them, and if you watch the video, you know how that worked out with my pain level. And I've had help financially and benefits thrown for me and fundraisers and such and so forth. But we're struggling with all these medical bills, and it just, again, not whining, not complaining, but it just takes its toll. I still haven't got the final bill from the insurance from the surgery. I know the surgery itself and all that was $78,000, and I'll only be paying a fraction of that. But it's all the tests and all that I had to do over the past year that added up, and just being off of work and not having the money from that. And like I said, I have to do all this again in 3 years, and it's just tough. It's just tough to think about. I know if maybe physically it might be easier in 3 years, but I won't even have this surgery and all this paid off by then, and I have to get ready to do it again. And everyone tells me it's going to work out, and I'm sure it will. But this is just what's going on with me right now. So many people in our Pectus group knows that one of our Facebook friends passed away the day after me from the surgery. And it's been really, really tough on me. If you've been following me, you know exactly who I'm talking about. Unfortunately, we never got to meet her or her family. I've been in contact with her family, and every one of them seems like they're just really great people, and who knows, one day we might get to meet, but the person that passed away will never, unfortunately, get to meet. And it just goes to show that this Pectus Excavatum isn't a cosmetic thing. So I just want to tell all those doctors that always told me that it's just cosmetic, I want them to go screw themselves, because people die from this. And I don't want to get into all the details about who and how, and I don't even have all the details, but I don't even know where I'm going with this, but it's just really tough. I just think about her and her family a lot, and I'm sure they might be handling it better than me. I don't know, but I'm sure it's tough. It's tough on me. It has to be tough on them. And if I somehow raise any money going forward, it's not going to my bills. It's going to their bills. But I don't even know if I'm going to raise any more money. I think that's pretty much tapped. I know they have a lot of help too, so I'll stop talking about them, but they just seem like really great people, and they might want me to mention her name, I don't know, but we haven't really got into that yet. But I'm actually sure they probably would want me to mention her name. But if you're interested in more about her, just check me out on Facebook or message me. And there's a lot of fundraising options for her and her family. So I guess staying on that same subject, so my surgery was on February 16th and hers was on February 17th. And we've been communicating through Facebook, and Facebook's awesome, Facebook Messenger. And today, I got the little red bubble that pops up on my Facebook Messenger saying, you have 8 unread messages. I'm like, wow, that's cool, but it's odd to have like 8. I mean, normally I have 1 or 2 or 0. So to have 8, what's going on? 8, not 8 of the little globe notifications, 8 direct messages. So I clicked it, and no new messages are there. So I found that odd. I'm like, okay, I clicked the little globe in the Facebook thing. I closed down the tab, opened it up. There it is, the messages, Facebook Messenger, 8 unread messages. I clicked it. Couldn't figure out how to make it go away. I'm like, this is stupid, but people that really know me, things like this bother me. I'm not going to let it go. I'm like, why isn't the number going away? So I'm clicking around, and I notice a little tab called Filtered. And I click that tab. And 6 out of those 8 messages was from this person that passed away from her family members, 6 different people. And I just lost it. And these messages are from a month ago, when I was still in Arizona. And they never popped up on my Facebook Messenger until today. So I messaged each and every one of them and told them the truth, and I'm sure they believe me, but it's just, why didn't they pop up until today? I might have had the chance to meet some of them out there, I mean, who knows if they would have want to met up with me at that point in time, but it doesn't matter. It's just, what are the odds that it would filter out 8 different people? And I tried to do some research on it today. Apparently, if you're not friends with the person that messages you, it goes into the filtered section, but they got to fix that. If someone messages you, it should go to your messages, not to some mystery filter page. But why didn't it pop up with 8 a month ago? But again, just venting, I guess, just kind of pisses me off. I can't really do anything about it now. So, but overall, I'm going to get through this. In a few weeks, I'm going to go back to my primary doctor so I can get the x-rays sent out to Mayo for my 6-week follow-up. And if I'm still feeling like this, I might get a referral or something for like a psychiatrist or a therapist or something, because I can't have any or many more days like this. It's just mentally draining. So I guess that's about it. But overall, I just want to send a positive vibe and message out there. But this is part of the journey. My journey, not everyone's Pectus journey, but I don't have any regrets for the surgery. I have 0.0 regrets on getting this surgery. I'm just having a bad week or a bad month, or I don't know when it's going to end, but I'm just struggling right now. And this is going on 15 minutes, and nobody's probably watching this. But if you are, thank you. If you do watch these, please tell me, or like it, or better yet, subscribe, because I want to be a strong, positive force in the Pectus community. And if you look at my YouTube channel, it's youtube.com/ and then there's like 100 different characters. And apparently the only way you can customize that is to have at least 100 subscribers and be active for 30 days. Well, I don't have 100 subscribers at all, anywhere near that. Not that I care. I just want to be able to promote Pectus awareness in any possible way. And if I can have a custom URL for my page, that would help me promote it and give it to people who don't want to share their Facebook information with me. So if you're watching, I can see how many views I get. I don't get very many, but I get more than 100. So if you do watch, I appreciate it if you subscribe to it, to my channel, or if you can share my videos or recommend them to people, even people that might not care about Pectus. I mean, there might be stuff out there that I never heard of, you know. Tell me about it, I'll listen. So, in the big picture, I just want to be a positive force, and that will help me promote, at least from the YouTube side. I'm still thinking of other things and I can do going forward to promote awareness and promote this person that passed away. So I guess I'm going to cut the video off soon, and I did not expect it to go on this long. I'm just kind of talking to the camera by myself right now, and yeah, so thanks for watching if you hung out this long. And then please just come follow or friend me on Facebook. I'm going to go back through all my videos and make sure all my Facebook information's on there. And if you have Pectus, or there's a lot of support groups on Facebook that are so helpful. So anyway, you wouldn't be watching video 16 at the 18-minute point if you didn't know what Pectus was. So I'm going to shut this down and get it uploaded and go lay down. But thanks for watching. Hopefully things will pick up soon. And I just don't want anyone to feel like I've let them down or have been whining or complaining. But I appreciate everybody's help. That's everyone that helped me all along the way. I appreciate everybody, and hopefully everybody received every thank you I've told them back, or texted, or called them, or wrote you a card, or hopefully everyone received every thank you I sent. I don't know what else to do but thank people. So I'm going to shut this down before it hits 20 minutes. I don't know when my next video will be. I don't anticipate making one next week, but you never know. And I'll probably end up making one after I get my x-ray and go from there. Well, until next time, I appreciate you watching. And if you can just do me a favor, if you are watching, if you don't mind, please subscribe. That will help me out, and that will help me promote and just get the awareness out there. All right. Well, thank you for watching. Good night.